Hello and welcome to our Functional Solution podcast, where we talk about everything functional medicine, root cause, and health optimization. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Chill.
Hi, everybody. Welcome.
So, as usual, every Wednesday evening, we come together and join forces to bring to you the best topics and most interesting research on health optimization and improving your patient's health. So, in today's topic, we have something that is really interesting, which is the 4 anti-aging strategies from an evidence-based approach. And we know that when we talk about anti-aging, there's a lot of there's different thoughts that come out, right? There's like how we look, or the appearance of our skin, our hair, our body weight, right? And we know that people want to feel good about, they want to feel good about the way they look. They want to feel attractive. That's obviously a very big part of the anti-aging movement, right? It is a big industry. We all know that the anti-aging industry, people pay a lot of money out of pocket to get that feeling of and that look, right? We know that there was an interesting survey. Global anti-aging market is now reaching about $72 billion of just people investing in their in supplements and consumer products and cosmetics and different procedures that insurance doesn't cover, like a lot of cosmetic procedures, right? But for us as healthcare practitioners, the reason we want to understand the process of aging is because with aging, we increase our risk of chronic diseases, right? So we understand that having a better looking skin might not be medically the most important thing, but when you're seeing patients with hypertension, diabetes, or arthritis, these are age-related diseases that can either kill you or kill your quality of life. So, this is why I asked Dr. Chill, who's a functional medicine physician with over a decade of clinical experience, to join me, where we can both share our experience, right? So I've been in healthcare for about almost 20 years now, and we're both very, very passionate about functional medicine, nutritional, herbal medicine, and we have hundreds of practitioners joining our program every year. So this is what we're passionate about. So if you are, and Dr. Chill, I know you've been doing coaching with a lot of our community members, physicians, nurse practitioners, even nurses, pharmacists who want to offer comprehensive care. So that's always a blessing, right?
It's fun, especially seeing these practitioners starting to get great results with their patients. And a lot of these practitioners are used to more of the conventional standard or the standard of care, where they're giving a pill or a medication. And what I'm hearing from these practitioners is they're wanting a different alternative. They're not seeing the results that they would like in their patients. And then when they start to work in the functional medicine space and actually start to utilize some of these approaches that we're actually going to be sharing with you today, they actually start to see their patients start to get better from a chronic health perspective, right? And they get really excited about that. And it's actually just a really, really, it's awesome to see a practitioner start to love their practice again.
Exactly. It's helping. That's something that I've heard as well as a feedback from many of those practitioners that go from a very stressful, 30 to 50 patients a day, when they just hand over more and more prescriptions and they frustrated. It's not just patients are frustrated, but also practitioners, because they don't see those health improvements in their patients, and they want to do something meaningful, right? They want to have a long-term impact. They want to transform their patients' health. They don't want to see those patients start on 1 or 2 medications, and then 10 years later they're on like 9 medications or 12 medications, right? So this is where functional medicine, the advanced and clinical approach that we have, is very, very useful for all healthcare practitioners. So in today's, and this is our kind of our transitioning from talking about functional medicine, treating chronic diseases, to talk more about how can we reduce the progression of aging, how we can mitigate it. We're going to talk about some really cool and interesting theories of aging, including oxidative stress, a concept called inflammaging, and the telomeres. We're going to talk about some really cool studies. And as usual, we're going to talk about what you can do about it for yourself, your family, and your patients. So the whole concept is, what are the 4 simple strategies that we can do for ourselves, our communities, to help them to feel better, look better, and have a better quality of life, and also reduce the risk of those age-related diseases. So we're going to start by talking about differentiating between chronic versus biological age. And so chronic age, we all know that that's typically how long have we existed, right? So from birth to where we are right now. While biological age is how old our cells are. And those sometimes those numbers are same for some people, but everybody ages at a different rate. And there's multiple factors that we can control in terms of our biological age. And this is really interesting concept to think about, because have you ever met somebody who looked younger than their age, right? For example, I met people that were in their late 40s, but then I heard that they're like close to 60, and I was like, wow, they look much younger than their health. Unfortunately, the opposite is very common, right? We meet people that are in their 30s or 40s, but they either look like, or they feel like they're in their 60s, right? And so this is where learning about the mechanism of aging and chronic diseases and how to optimize health is very helpful. Unfortunately, it's not taught in medical programs, right? And so you can use the same strategies we're going to talk about today to keep yourself, your family, and your patients feeling and looking younger. And in the field of gerontology and anti-aging medicine, there's a common used distinction between biological and chronological age. We're going to talk a lot about biological aging. And there's a lot of recent developments in epigenetics that suggest that our genes, the epigenome, the chemical changes that happen above our DNA, above our DNA sequence, might be the key to understanding and calculating the human biological age. So we're going to talk about these different topics. And of course, there's a lot that we can do about it, right? So our first concept that we want to talk about is telomeres. And telomeres are really important. They're important because they are one of the ways that we could measure biological age, or how old our cells are. And they're impacted by lifestyle factors, which lifestyle, nutritional, there's multiple factors we're going to talk about today that can impact these, the biological aging and the onset of age-associated diseases. So Dr. Chill, take us into this cool little quiz on telomeres to warm up.
This is a really fun topic. My specialty was skin health in San Diego. So many of my patients would come in and they would say with certain skin issues, right? And they would say, I tried this topical treatment, and it keeps coming back. And it's because they're not handling some of the internal aspects. Actually, internal makes up anywhere between 60 to 80% of what's showing up on the outside. And so I'm really excited to be sharing some of the internal aspects so you can understand what's happening internally, and you can start to relate this information to some of your patients as well. So let's start with a quick little quiz on some of the internal aspects. Let's talk about telomeres here. Now, which is true about telomeres? A, they protect the ends of our DNA chromosomes. B, with each cell division, a small portion of the telomere is lost. C, some drugs could reduce telomere length. D, shortening of the telomeres is associated with aging and diseases. E, all of the answers are correct. Or F, all of the answers are correct except for C. I will give you a little bit of time to look through these and figure out what the answer is. All right. Well, if you guessed or picked the answer E, that is the correct answer. All of these answers are correct. They protect the ends of our DNA. That with each cell division, a small portion of the telomeres are lost. Some drugs can reduce telomere length, and then shortening of the telomeres is associated with the aging and diseases. This is where we're going to focus on today, is the telomeres and how it impacts our aging and how it can impact our risk for certain chronic diseases. So what's interesting to mention with these medications that we were talking about in this quiz, there's certain medications such as prednisone and then other immunosuppressive drugs. These are suspected to be associated with telomere length reduction. So there are some things with medications that can actually shorten our aging process, or I'm sorry, that can actually increase our aging process. And if you want to read a little bit about this and dive into some of this information a little bit more, there is a great study on this topic. It's called Telomere Length and Use of Immunosuppressive Medications in Idiopathic Pulmonary Fibrosis, and that's by the American Journal of Respiratory and Critical Care Medicine. And that information is right there for you to check out. Now let's dive a little bit further into what telomeres are. And the best way to do this is to do it through a picture. So let's pop up this picture here so you can see what a telomere is, where it belongs in our cells and our chromosomes and our DNA. So in this picture here, you're seeing telomeres are a specific DNA proteins. These are what protect the ends of our chromosomes. They have several functions. This includes chromosomal stability. This is where the telomeres will maintain the stability of the chromosomes, and they're going to prevent the degradation. It's going to help with DNA protection. This is where they're going to protect the ends of the chromosomes from damage, accidental recombination, and DNA end joining. It's going to help with DNA repair. The telomeres are going to prevent the DNA repair systems from mistaking the ends of the DNA strand from a double strand break. And it's going to help with cell division. Telomeres are actually required for cell division in almost all animals. And as a part of the normal cellular process, a small portion of our telomeres are going to be lost in each cell division. This is why telomeres are really important in the anti-aging or the aging process that we're seeing with our patients and in ourselves as well. So what happens with the telomere length is when it reaches a critical limit, the cell is going to undergo what's called senescence and or apoptosis. Now, what are senescent cells? These are going to be the cells that have permanently stopped dividing but have not died. And why this is important is that the cellular senescence has many functions. in the regulation of embryonic development, in wound healing, and suppressing tumors. So this is an important process in the cellular lifespan as well. However, with prolonged senescence, this is associated with the development of tumors, chronic inflammation, immune deficit, and then exhaustion of our stem cells. So it's important to understand the balance between apoptosis, senescence, and the telomere length. And unfortunately, it's the number of senescent cells in a person's body. This does increase with age. And what we will typically see with telomeres is there's an enzyme called telomerase, and this is the enzyme that in cells helps to keep them alive by adding DNA to telomeres. And this is the end of the chromosomes that we were seeing earlier in the picture. And this is also really interesting to mention about telomeres. There are some animals that have a really high activity of telomerase, which keeps them young. So an example of this is lobsters, or our lobsters. They actually maintain a high activation of the telomerase activity that I was just mentioning, and this continues to extend their telomeres as they age. And what is the result of this? They actually maintain long-term cell proliferation, and then it prevents the senescent cells that I was mentioning earlier as well. They will still age, but at a much, much slower rate. And that's what we're trying to do internally for our patients, is to help improve and optimize these telomere lengths for our patients. And so let's talk about some of the major concepts of aging, and Dr. Cohen is going to discuss some of that.
Thank you, Dr. Chill, for providing us this overview. So now we better understand how what's happening to our DNA, right? And our chromosomes are just getting shorter and shorter as we age. By the way, you mentioned lobsters. Some animals can keep maintaining the high activation of telomerase. It's really, really interesting to mention. There are studies that are now showing us that cancer cells can also increase the telomeres to achieve unlimited growth, essentially. So there are some really cool studies showing that most cancer cells activate the telomerase, which is, again, that protein you were talking about, which prevents those telomeres from shorting and prevents cell death or senescence in these cancer cells. Now, we're not going to dive into that because that's a really big topic on how cancer cells thrive, how cancer cells resist the ongoing damage from the immune cells, from natural killer cells, and how the cancer cells thrive. But just wanted to mention that because there's some really cool studies on how cancer cells maintain their length of their telomeres and achieve unlimited growth. So with that being said, let's go into the topic that is associated with senescence, which is inflammaging. So inflammaging it's a big topic, but I wanted to give you some overview. So let's start with warming up with a little quiz. So what is inflammaging? And you're welcome to put it in the chat. We'll be watching the chat to see your responses. So inflammaging is a chronic low-grade inflammation that is associated with accelerated aging and disease. B, inflammaging is a chronic low-grade inflammation that is a healthy protective response by your body's immune system. Or C, both are correct about inflammaging. Which one do you think it is? Put it in the chat and we'll talk about it. Okay. Okay, great. So the correct answer is A. Inflammaging is a chronic low-grade inflammation that is associated with accelerated aging and disease. Important to remember that inflammaging is not a healthy response. So when we talk about inflammation, this is an important distinguishing factor. While acute inflammation is essential for repair of our tissues, chronic inflammation leads to an increase in the reactive oxygen species, oxidative stress, and damage to our cells. So let's take a look at these really cool pictures from the Journal of Signal Transduction and Targeted Therapy. We can see this simplified pathway of inflammation at a molecular, cellular, and organ level, right from the top, from the left side, which we have a young patient, all the way to the right side when we have an aged patient or a sick patient. And on the top, you can see the different cells, right? So we got immune cells, we got stem cells that are involved in this. And essentially what's happening here during the aging process, cells in our body undergo senescence. And which means that they're, as Dr. Chill mentioned, they're going into a dysfunctional state. And what the studies, the researchers are referring to as senescence, associated secretory phenotype, or SASP. You can see it in the middle, there's little dots, SASP. So oxidative stress, for example, or chronic inflammation, turn our cells, our young cells from the bottom left, to senescent cells, and then from there to what we refer to as senescent associated secretory phenotype, or SASP. This process is accelerated by inflammation and oxidative stress, and that's why we call it inflammaging, right? The accumulation of those cells can trigger inflammation in the organs, leading to organ damage, increased risk of age-related diseases, right? So if you got a lot of inflammation, you got chronic, even low-grade chronic inflammation and oxidative stress, right? It contributes to senescent cells and dysfunctional cells. Those dysfunctional cells contribute back to the formation of more senescent cells, right? So it's such a vicious cycle that constantly contribute to each other. And of course, with the damage, ongoing damage to the tissues and organs, we also see the age-related diseases, right? So that's what we call accelerated aging. Now, of course, you can see on the middle right, there's microbiome that can kind of feeds into that tissue and organ inflammation, because if you have a change in your microbiome, in your gut microbiome, it can contribute into either to health or healthy metabolism and reduction in inflammation, or more inflammation and dysfunctional metabolism. We're not going to get into that now. The gut health is it's a massive topic, and we dive much more in depth into it during the Advancing Clinical Functional Medicine program. But I just want you to think about this, that it's all connected, right? Now, beyond diet and lifestyle and gut health that we just talked about, there are multiple triggers that can contribute to this subclinical chronic inflammation, right? And how do we identify those triggers and what exactly do we do about it is what we teach in the Advancing Clinical Functional Medicine program. And you're going to learn all about it and the advanced testing that they don't teach you in medical school, and what are the specific treatment protocols. Now, as we mentioned, senescent cells can significantly impact our function. I'm going to show you a really cool study, really cool picture from the Journal of Biology. This was published in 2021. And in this particular study, you can see in this picture, you can see the damage that occurs with shortening of telomeres as a result of aging, inflammation, and oxidative stress. Now, we can't do anything about our chronological aging, but there's a lot that we can do about inflammation, finding out what triggers that inflammation, what feeds it, right? Is it because the patient is exposed to something in their environment? Is it inflammatory diet? Is it stress? Is it hormonal imbalance? Is it mitochondrial cellular dysfunction? Like, what is it? We can figure that out, right? We got the tools, we got the lab testing, we got it all. We can figure it out, right? That's exactly what you're gonna learn in the Advanced Functional Medicine program. We'll teach you the whole system and how to use it right away from the first or second month in the program. There's a lot we can do to reduce oxidative stress as well. And what we could do, there's a lot that we can do to reduce the process of senescence and reduce these, type 2 diabetes, the cardiovascular diseases, Alzheimer's, all of these age-related diseases, right? So, so another factor to think about is when our cells turn into a senescent cells, a healthy cells turn into a senescent cells, it can also impact your ability to withstand stress or illness, right? Also, your ability to recuperate from injuries or your cognitive function with your ability to learn new things, right? And prevent that degradation in cognitive function, right? Now, if you're in your 30s, your 20s, or your 30s, you might not feel that yet, but it's coming to all of us at some point, right? The symptoms we start feeling in our 40s, 50s, and 60s, right? And especially the best time to start working on our health and learn these functional approaches is not when we're sick, right? Because we know that Alzheimer's, all these degenerative age-related conditions start 10, 20, 30 years before the symptoms already occur, right? So this is why it's so important to understand these topics, especially for patients that are already coming to see you. They already have diabetes, osteoporosis, cardiovascular diseases, chronic fatigue, Alzheimer's, stroke. They already going through this accelerated aging process for years, right? So this is where you are the person to guide them through and help them to restore their health. That's why we see patients coming in and paying our community members between $200 to $800 per session to tell them what they need to do to start reversing this accelerated aging process and start restoring their health, right? So you can read more if you want to about there's an interesting article called "Does Cellular Senescence Hold Secrets for Healthier Aging?" This was published in July 2024 in the National Institute of Aging website. But we're going to dive into strategies. So this will be your takeaway of what you can help your patients with. So Dr. Chill, take us into anti-aging strategy number 1.
Absolutely. So now that you are aware of some of the internal aspects of accelerated aging, what are some of the strategies that you can do yourself, or you can start to educate your patients on to either protect yourself, your family, your patients, and then your patients from cellular damage and accelerated aging? There are specific supplements that were found in research. These are the clinical relevant supplements, and these can help to mitigate some of the cellular damage that we were talking about, but we'll get into those soon. For now, we want to focus on a few important nutritional factors that you want to look into as well. So I want to show this through a picture. Let's pop. Perfect. There we go. So here in this picture, we can see the role of antioxidants and anti-inflammatory agents in telomere maintenance. This was published in the Journal of Frontiers in Aging in 2024. On the left-hand side here, you can see some of the important antioxidants. These are the anti-inflammatory agents such as vitamin C, E, and then phytonutrients are important as well. These are all found in fruits and vegetables. This is another reason why incorporating many fruits and vegetables into your daily intake is really important. Another nutrient that we want to look into are omega-3 fatty acids. These are important to help with reducing chronic inflammation and reducing damage to our telomeres. And then on the right-hand side, you can find two major causes of telomere damage and oxidative stress and inflammation. So a lot of times our patients will be on what's called the standard American diet, or SAD. And this is very low in vegetables, fruits, and omega-3s. This is why it's really sad. And unfortunately, it's the standard American diet This is also high in sugar, artificial food additives, and other chemicals. This includes fried food and then a high amount of omega-6s. This is high in most animal products such as meat, chicken, and pork. And this is what can cause damage to our telomeres, which can accelerate the aging process and increase the risk of chronic diseases for our patients, along with increasing the aging process externally for them as well. Now, what are some simple ways that we can do to increase some of this good stuff, right? The vitamin C, the vitamin E, the phytonutrients, the omega-3s. The first thing you want to do is ask yourself, or have your patients ask, how can I add at least 1 cup of vegetables with each meal every day, right? And this is not including potatoes. A lot of patients will think that potatoes are a form of vegetables that they want to incorporate. It's not necessarily the potatoes that we want to incorporate. These are starches, right? What we want to look at is more of the fruits and vegetables. So how can you add in 1 cup of vegetables to each meal? And then an easy and fast way to introduce 1 cup of fruits every day is through a smoothie. So 1 cup of berries is high in phytonutrients. Remember that picture that I showed? Phytonutrients are a part of the nutrients that can help with the aging process and acts as an anti-inflammatory. And you can add in 1 or 2 spoons of almond powder, which is the protein, and also unsweetened hemp milk or coconut milk. And this is going to help to reduce some of the absorption of the glucose from the fruit. So this is a really easy way to introduce 1 cup of fruits every day. Another thing is to add in omega-3s. This can help to replace meat, and you can replace meat by adding in fish 2 to 3 times per week. And then you can also look at taking 2 to 3 grams of omega-3 supplements every day as well.
Those are really, really important concept that we very often use with every patient in our practice that comes in, and we see the signs of accelerated aging, like cardiometabolic conditions, all the way to diabetes type 2, or they just don't feel well. They feel fatigued or anything like that. So that's where we really start. And then, like detectives, we try to figure out what's also driving that damage, that oxidative stress and inflammation. So really good tips. From here, let's move into strategy number 2, which is physical activity. So physical activity offers a wide range. We all know that it's great for mood, reducing the risk of chronic diseases. It's good. It's helping us for better sleep quality, stronger bones and muscle. All of that is great. But there are different types of physical activities, right? So which one do we pick, and which one is most beneficial for reducing cellular aging and preserving our telomeres length? So let's take a look at a little quiz to see which type of physical activity is most beneficial when we talk about preserving cellular aging and anti-aging. So option A, we got aerobic training, so such as walking, running, or using the treadmill. That is very, very common in the gyms. Number 2, strength training, such as lifting weights, resistance training with machines or body weight. And option 3 is yoga. So which one of those were found consistently to be most beneficial? You can put it in a chat. I'll give you a couple of seconds. Which one do you think it is? Aerobic, strength training, or yoga? All right, so the correct answer is B, strength training. So there's a very interesting study that was published in the Journal of Biology in 2024. And they surveyed 4,814 adult Americans. And they looked at different types of exercises. And they reported that strength training had a positive impact on telomere length. And they found that just an hour and a half a week of strength training was associated with close to 4 years of younger biological age on average, right? That's huge. Now, they also reported that for every 10 minutes of strength training that you are doing every week, the telomere length is going to be almost 7 base pair longer on average, right? So it's really cool because it's a study that showed us that we can, by exercising every extra 10 minutes of strength training, right? Push-ups, lunges, doing weights, right? Every 10 minutes of strength training, we increase our base pair of telomeres by seven base pair. That's how they measure it, right? So, and then there was another interesting study that found that those who trained more than an hour per week had longest telomeres, right? So here's the study if you're interested in reading more about it. Telomere length in biological aging, the role of resistant training. This was published in the Journal of Biology in 2024. So the recommendation that we will have for you and for patients is to consider 30 minutes of strength training 3 times per week. You can do it through a class. You can do it through just stopping at the gym on the way back from work, doing like that 20 to 30 minutes. Just pick for yourself 5 or 6 machines and just do 2 or 3 sets of typically 6 to 10 reps is the most recommended, right? So that was physical activity. So Dr. Chill, take us to the next strategy, which is really, really important as well.
Absolutely. This is important in many factors in health, right? Including aging. And this factor is sleep. And with sleep, we actually want to break down sleep a little bit for you. When we're talking about sleep, there are several important factors to consider. This includes sleep duration and sleep quality. What has been shown is that short sleep duration, or even in sleep apnea or insomnia, these are significantly associated with shorter telomeres. And this is the biological marker of cellular aging that we've been talking about. And if you are suspecting a patient has sleep apnea, it's actually best to recommend them to referral to a sleep study. Now, beyond sleep apnea, there are multiple factors that can lower our sleep quality. This includes hormone imbalances, HPA axis dysregulation, glucose imbalances, food allergies or food sensitivities, digestive problems, inflammation of the sinuses. The list actually goes on and on. But you can learn much more about that. And we dive into that and the treatments of sleep disturbances and insomnia in the Advanced Functional Medicine program. Now, many patients and many of your patients will ask, what is the best number of hours to sleep? Well, in a study that was published in the Journal of Sleep, researchers reported that sleeping an average of 7 hours or more per night actually was associated with longer telomeres. And if you want to read a little bit more about that study, it's actually called Telomere Length is associated with sleep duration, but not sleep quality in adults with human immunodeficiency virus. And this was in sleep. And that is, we just posted the study there for you.
Wonderful. So far we have covered inflammaging, the concept of inflammaging, what our telomeres, the role of our telomeres in aging, right? And very important concept that dictates how we feel when we wake up in the morning, how we manage ourselves and operate on a daily basis, right? And of course, what with over time, this has a compounding effect, right? So doing this for 3 months, right? Where more studies look at the 3 to 6 months, right? Some studies look at like a year or two, but it has a compounding effect. So the more you implement these, right? The physical activity we mentioned, 30 minutes, 3 times. Strength training is especially important. You can also integrate aerobic training for cardiovascular health, but strength training is really, really important. And then Dr. Chill was talking about sleep. Sleep is essential. We dive much more into all of these topics in the advanced functional medicine. We have a whole class on inflammaging and different strategies. But now you understand the nutritional protocols, some of the nutritional tips. Dr. Chill talks about sleep. I talked about the physical activity. And then we're going to go diving into targeted supplements, and more particular, one of the supplements that is showing up in so many clinical studies as a very, very beneficial compound for supporting healthier aging. And this is resveratrol. So resveratrol is a polyphenol that is primarily found in grapes, in red wine, in grape juice, berries such as blueberries, cranberries, and some in peanuts as well. And research have found that resveratrol has antioxidant impact, anti-inflammatory, anti-aging, and anti-cancer effect. And supplementation with resveratrol has been found to reduce biomarkers that are associated with inflammation, such as reactive oxygen species, tumor necrosis factor alpha, and interleukin 6, which we know that are associated with inflammation. Now, there's a few really cool studies that I wanted to mention. One of them is an animal study that was published in the Journal of Reproduction and Development in 2024, and they reported that resveratrol supplementation increases the mitochondrial DNA copy number and the length of the telomeres. Now, when we talk about human clinical studies, there are several human clinical studies with patients who reported that resveratrol has a pro-telomerase effect. This is really cool because they found that it supports the function of that enzymes, the telomerase, that helps us to extend our telomeres. Now, this also has a DNA protecting effect. And in one particular study, this was published in the Curas Journal of Medical Science in 2020, researchers reported that resveratrol has cardioprotective effect and support a healthier telomere length in patients with myocardial infarction. So again, this is why it's so important for us to understand the process of aging and what the factors that contribute to accelerated aging, because we all see as healthcare practitioners, you see the end results of this accelerated aging, which is type 2 diabetes, cognitive decline, chronic fatigue. There's cardiometabolic conditions, right? They come to see you, right? And we don't think about what led to that development of this condition and how can I change course towards better health, right? This is obviously very different than the pill for every ill approach, right? We're looking for a more comprehensive approach. We want to get our patients to be healthier, feel better, and this is why, we're healthcare providers. It's not just disease management providers, right? We're healthcare providers, right? We should talk about health with our patients. So what would be the recommended dosage to reconsider? This would be 100 to 500 milligrams per day. In some cases, and we go into this more in the Advancing Clinical Functional Medicine program, more specific cases and some specific conditions, we can go higher. We can go significantly higher dosages. But for now, when we considering a general dose, that will be 100 to 500 milligrams per day. If you want to read more about this, there's a couple of really cool studies. Resveratrol and Health, Comprehensive Review of Human Clinical Trials. This was published in the Journal of Molecular Nutrition and Food Research. And then again, we'll post here the previous study that was done with post-myocardial infarction remodeling. This is from Curas, the journal called Curas Journal of Medical Science. It's published in 2020. So these are some cool recommendations. And Dr. Chill, I feel like we covered some really good topics. We covered some lifestyle factors, nutritional strategies. One of the several supplements that are great for anti-aging, supporting healthier function. And then, of course, if you guys have any questions, feel free to reach out to us, because every month we have new practitioners coming to and learning in our accelerated quick start functional medicine program and our certification program. They're learning how to take all of this approach and start putting it into their practice, start building more cash services, right? Increase their income by thousands of dollars every month. So that's why we want all of you to have more satisfaction from the work you're doing, a better income if you choose to, and of course, really make a difference in your patients' lives. So if you're in our community, you're also invited to schedule a coaching call with Dr. Chill, where he shows you one-on-one how to use the clinical evaluation tool to identify the root cause and some of the advanced lab testing. So that's open to all of our community members in the Advanced and Clinical Functional Medicine program. You're also welcome to reach out to us if you have any questions, if you want more information about our different programs that we have. And we are launching in February, the first week of February, since we had such a huge request for doing a program that is very specific on weight loss using the functional medicine approach, which is identifying what's causing weight gain. What are the 6 major factors that cause us to gain weight, right? And so we're doing a special program. We're opening a special program in February. We got limited number of practitioners, unfortunately, that we can take, because this program is a 2 months program. It's like condensed. It's like 2 to 3 hours a week, and then you get certified. But we have limited number of seats because every week we meet up together for 1 hour to discuss one factor that causes weight gain, strategies, functional labs specifically for weight gain or obesity. So it's 1 hour a week of live, and then it's about an hour to 2 hours of kind of self-paced. So you get a lot of support. We also talk about how to build successful functional medicine weight loss programs. Both myself, Dr. Chill, I've been doing this for years. You also have amazing practitioners that are also teaching in this program, like the master nutritionist Jess, and also Dr. Caviola. So this is going to be awesome. It's going to be awesome. You're going to learn so much, and it's short. It's condensed 2 months, but we have limited seats because this is a live and on-demand program. So we can't take more than, unfortunately, a certain number of people. We want to make sure that we can provide that personalized attention to each person as well. So if you want more information about it, reach out to us. We'll be posting this week some additional information and where to register. And then we're offering special early bird discount to all of you for being here. So I want to thank Dr. Chill for being here.
Thanks for having me.
Yeah, thank you for contributing, for you sharing your years of clinical experience. I also want to thank our media team and Jacob for allowing us to be with you wherever you are. And of course, I want to thank all of you and each one of you for continuing to show up for your patients, to continuously grow your skills, develop your skills, and offering a comprehensive approach that shows them how to restore their health. And they're not going to get that anywhere else in our mainstream system, right? And it's very unfortunate. So thank you for everything that you're doing for your community. And with that being said, Take care for now, and we'll see you in our next class.